Greetings, Earthlings. Welcome to Open Now Heart Surgery. You don't know this about me, but I'm actually a doctor, so you should now refer to me as Dr. Lawrence Omega. So here we go. We are going to press the operate button. Hello again, Doc. It's me, Nurse Laura, and I sure am glad to see you at Sir Flax Hospital again. Again, I've never been here before, Lara. You're clearly mistaking me for someone else. If we team up like we have before, every patient in the hospital will be better in no time. Well, that's fantastic. That's what all doctors want. Continue. Warning, don't try this at home. Why would I try this at home? Our patient today is Joe. He was born with a weak heart. That sucks. I'm sorry to hear about that. Which causes him to get tired a lot faster than the other kids his age. If not treated, his condition will be life-threatening. What's wrong with his clothes? Are these the hospital clothes? Are we providing rags for them to wear in hospital? That's horrible. And we gave him a soccer ball. He gets rags, but we gave him a soccer ball? Or did we let him come in here with a soccer ball covered in germs? Oh boy. Oh boy, this is a bad hospital. Continue. Our patient, yeah, we just saw that. Don't repeat yourself. Grab the stethoscope. Wait. They want me to do actual doctor work? No. I'm a doctor of history. I'm not a doctor in medicine. That's way too hard. Well, this is just great. Fantastic. You know what? I have a friend who's a great doctor. I'll go and get him. See you in 5 minutes.
Well, hello, young children. I am Dr. Blorgen. It is important to never mention my name, for you shall be arrested in 90 different countries. You see, I am a doctor, and the best one in the world. However, none of my practices are orthodox or legal. Therefore, you shall never mention my name. However, there is one place I can perform them, and that is Egypt. For you see, in the late 1700s, I accidentally released a few experiments in Egypt, and ever since then they've been terrified of me. So they will never report me, but everywhere else, no go. So, what seems to be the problem? Grab the stethoscope so we can check his heart condition. Don't tell me what to do, nurse. Here we go. Stethoscope. Which one's that? Clamp? You failed. Don't joke. This is medical. No. You're wrong. You see, you start with the clamp, not the stethoscope. Well, let's just fix this. Very well. I shall do as you say. Otherwise, you'll kick me out of the hospital. What kind of nurse has the power to kick a doctor out of the hospital? Anyway, here we go. The stethoscope, correct? Yes, exactly. Yes, shut up. Get out of my way. No, you do not use a stethoscope on his back. You use it on his heart. What is he even having? Okay, Doc. Let's go to the operating room. It should be, one of these 3 rooms. Does he need an arm x-ray? Does he need his leg x-ray? That's not an x-ray. That's an operating table. I knew that, for I am a fantastic doctor. Or his heart. Well, this was heart surgery, so I believe it would be the heart room. First, we need to sterilize it. Yes, there we are. Pick up these tongs. Which one's a tong? This one. Tongs. Okay. Grab a cotton ball. Sure. Dip the cotton ball in iodine. No. That's not how we do it. You are doing this horribly. What you do is you sterilize. If you sterilize the cotton ball, it wax. Therefore, it's very waxy, and it works far better. Apply it to the patient's skin. Yeah, well, obviously. Now we'll draw a line on Joe's chest to mark the incision. You will need a marker. Oh, well, that's just fantastic. I don't need a bone stapler. Why are you even putting these things on the tray if I don't need them? They're like, here's a whole tray of objects. Use the marker, you idiot. Okay. Here we go. Oh no, that's not good. Time for the first incision. Grab the scalpel. This one's the scalpel, correct? Let's make the incision now. Here we go. Well, that is far more violent than I thought it was going to be. The incision has caused some veins to bleed a little. Oh no, I'm squeamish. This cannot happen. I'm terribly squeamish. Use the bovie to fix this. That's not a real medical instrument. I guess we'll use it. Cauterize the veins with the bovie. This one? Yes. Good job. This one? Yes. Keep praising me. I like it. Good job. Good job! Oh crap, I missed one. Oh well, it doesn't matter. We need a clamp to spread the skin and muscles and reveal the rib cage. Grab it now. I don't think I want to do that. Let's use a clamp here. Okay, we should not be getting a clean look at his heart. This is clearly going wrong. This is not how I normally do my procedures. Normally they're nearly dead when I start. Normally the heart is not beating like normal. Okay, now take another clamp and use it to open the incision further. Oh, a clamp! Okay. I don't think this is a good idea, nurse. I think you should get out and let me do it. The rib cage blocks our access to a dog's heart. We're going to have to cut through it. The bone scissors should be perfect for that. Bone scissors. Here we are, bone scissors. No. This is a terrible idea. You never cut through the bone. The bones are very useful, you see. You remove them. You don't cut them because you can put them in other objects. Oh, give him more bones from other people. It's fantastic. We shall now chop the bones just like we're chopping here. Okay, we need to remove any bone fragments with the tongs. Shouldn't we use the laser? Nurse, where's the laser? How outdated is their technology? I'm not used to using such outdated technology. Pick the bone pieces out of there. Nurse, this is disgusting. This is your job. You see, I'm the doctor. I tell you what to do, not the other way around. Before we continue, we have to move his nerves out of the way with his string. Of course we do. With this string. Nurse, this is the most unqualified thing I've ever seen. You want me to pull a string out? Good job. Now let's tie it back to the other nerve. What? String? What do you want me to do? What is she after? I'm squeamish. This is terrifying. Wait. Doc, remember, calm down. Use your second heart and your second lungs to breathe. Good. It's not in the way now. Let's tie back the other nerve. Okay, with the string. Here we go. Pull the string back. Excellent. We're running out of time. We're going to hook up Joe to this pumping machine during that transplant. Match the tubes based on color, going in alphabetical order. Start with tube A. Tube A is red, so we attach it to the red. Blue? Oh, good. I'm good at matching colors. I can do this. There's no more blood anymore. This is fantastic. And D. Excellent. Excellent work, Doctor. Wow, we're back to the heart. Grab a tube and drag closer. Place the tubes, Doc. Sure. And this blue one? And if I'm sick by the end of this, I apologize, but I'm just not used to seeing blood. You see, I normally have all the blood removed by my assistant before I start. We're removing Joe's heart. You need the sharp-tip scissors. Sharp-tip scissors. I hate this. I'm squeamish. Attach it to the tube. This is serious stuff. Not the right tube. Grab the sharp-tip scissors. We're running out of time. No time to look away. We must do it quickly. Quick. We must be fast, or this young boy will die, and it will be all your fault, nurse, for giving me terrible, terrible advice. Okay, cutting his heart is a terrible idea. Why are we doing this? Can't we just send him home? No. We took out his heart. What have we done? Okay, put the new heart in the patient's cavity. We got a new heart? Oh no, I forgot to wear my mask. I just spat all in his heart. This was a terrible, terrible thing. Okay, we need suture thread now. What? I've never heard of that. Why is this so outdated? Where's your lasers? Quickly, thread it all together. Nice. Good job. Focus, Doc. What do you want me to do? More thread? What do you want me to do? Focus, Doc. Which one? Oh, I just tap it. Okay, good. Good job. Quick, put the bones fragments back in. He's running out of time. He's gonna wake up. Use the tongs. Okay. He's gonna wake up and we'll still have his heart open and he'll scream because the anesthetic will be off. It'll be terrible, Doc, and it'll be all your fault. Now put the bones back. Excellent work, Doc. Quick, stitch him up. We need the bone stapler. Do it quickly. Quick. We're running out of time, Doc. We're running out of time. We're not gonna make it. Quickly, put him back together. And apply bone paste. Which one's that? This one. Quickly, Doc, quickly. Quickly. We're not gonna make it. 5, 4, quickly. Quick, remove the clamps. Quick, stitch him. No! We lost him. My first patient in this new hospital. And he died. I am a disgrace to all doctors everywhere. A disgrace. But don't worry, boy. Don't worry. For I have a time machine. Back we go. Alright, my dear boy, this time I shall save you with my medical mask on. I have never worn one of these, but it's very uncomfortable and hard to breathe. And whenever I breathe in, it gets stuck to my face. This is horrible. Absolutely horrible. Okay, the timer has started, and This thing keeps going into my mouth. Why would anybody wear this? This is terrible. Grab the scalpel. I'm going to die at this rate. How does anybody wear this? This is terrible. Quickly. We've already wasted 20 seconds just getting him open. I can't believe it. This is awful. Alright. We cut open your heart once again, and this time we shall be fast, and you shall not die. With the tongues, of course. And I can hardly breathe with this thing on. You know what? Forget this. I am an illegal doctor. I'm taking it off. Now I'm using the string. How does anybody even breathe with those things on? That nearly killed me. That was horrible. Now we match the tubes. Yes, I'm good at the color matching. Good job. Yes, nurse, I am. Now can you leave so I can do this in peace? Okay, don't tell me the colors. I know. But if I want to put the yellow one in D first, then I'm going to. Okay, grab the tube closer. Quickly. And this one, why are we dragging the tubes closer when we have to cut them? Shouldn't we keep them far away, then cut the heart, and then we do it with the scissors, of course. Cut. And grab the tube. Grab it. Okay, good. We're not going to let you die this time, young boy. Not this time. Because this is a good time, man. Sharp tip scissors. Oh, here they are. Why do they move every time? That's rather annoying. Nurse, whenever I go to attempt a thing, if you could not move the sharp tip scissors around the tray, that would make this far easier. And I'm still recovering from my losing breath from that mask. How can anybody even operate with that? Okay, good. We've taken the heart out. Replacement heart. It's a good thing I brought my replacement heart from the lab with me. Otherwise, he would just die because we do not have replacement hearts. We need to suture the thread now. I am the best surgeon there is. Nobody else could do this. Thread? What do you mean? Speak English. There's no thread. Search a thread. Oh, that one. Okay, there was such a thread. Quickly. And nice! Good job! Oh, where? We put stitches on his heart? That's not possible. Okay, oh, tongs! Why can't I just do it with my bare hands? If I want to do it with my bare hands, then I will! You're not the butt of me, nurse. I am the doctor here, not you! Now we use the bone staple. Yes, I knew that. You don't need to tell me. I was not going to stitch him up with... Wow, are we really doing this to his bones? Just stapling them back together? Can't be like... At least... Oh, we are gluing them. Good. But a staple's way worse. Do we really need that? Can't we just use glue? Because we're going to have to go back in there at a later date and take those staples out. Otherwise, he's going to get aluminium poisoning. Remove the clamps. Yes. This is where he died last time. But this time. What do we need? Stitch it up. Go. I've saved this young boy's life. I'm just that great doctor. Wait. The patient needs a chest cast to keep him from moving too much. Chest bandages. Here? There we go. I've got to hand it to you, Doc. Thank you. The operation was a big success. I'm sure the patient will make a full recovery. Even better, he'll be able to run and play sports like never before. That's just fantastic. I mean, they don't call me Dr. Blorgen for I forgot my name well when I'm getting drowsy. Okay. How does anybody walk around all day with those masks on? Do they just never talk? They're horrible. Maybe they have, like, really good ones. New mode unlocked. Hooray! Play hard mode. No, I don't want to play hard mode. No, thank you. Why would I go back in time and do hard mode when I've already saved your life? Stupid child. Well, you're smiling. You don't know that I killed you once and had to go back in time to save you. Mistake penalty. 0 points. Time. Wait, no, it didn't take me 1 minute. That's the time left. 1 minute and 38 seconds. And scored 9,800 points. Well, maybe next time we'll play leg surgery because it's telling me to. It looks like I need it in another leg surgery room. Anyway, congratulations. Thank you for watching. Maybe I'll appear in another video. I don't know. And goodbye. And never mention my name.